Today, we're going to talk about a part of your body that's both incredibly powerful and, honestly, surprisingly delicate. It's what lets us speak, sing, and even just breathe. We are talking about the larynx, but you probably know it as the voice box.
So let me ask you this. What could a singer losing their voice after a show possibly have in common with a terrifying, life-threatening emergency where someone can't breathe? I mean, one seems like a minor annoyance, and the other is an absolute crisis. What's the link?
Well, the answer is that they both start right here, in the larynx. This small but really powerful structure is basically mission control for our voice and a critical gatekeeper for our airway. And when something goes wrong with it, the consequences can be huge. Now, to really get a handle on what can go wrong, we first have to appreciate just how it's all supposed to work. So let's take a quick tour of the anatomy of your voice box.
So, what exactly is the larynx? Well, think of it as this incredible piece of biological engineering. It's made of cartilage, muscle, and a soft membrane, and it juggles three absolutely vital jobs: letting air in and out for breathing, snapping shut to protect your airway when you swallow, and of course, creating sound so you can speak, what we call phonation. It's a real multitasker.
The whole thing is built around a cartilage skeleton that gives it its shape. You've got the thyroid cartilage, that's the Adam's apple you can feel in your neck. Below that is the cricoid cartilage, which is a complete ring that acts as the foundation. Then you have this brilliant little piece called the epiglottis, which is like a leaf-shaped lid that slams shut to keep food from going down the wrong pipe. And then, super importantly, you have the arytenoid cartilages. These little guys are what actually pull the vocal cords around.
And inside that skeleton, we find the folds. Now, a lot of people don't realize you actually have two sets. You've got the false vocal cords, which sit on top, but the true vocal cords, they're the real stars of the show. They're the ones that vibrate to make the sound of your voice. And that space between them, that's the glottis, and it's the gateway to your lungs.
Okay, so that's what a healthy larynx looks like. But what happens when things start to go wrong? How does this intricate system let you know that there's a problem?
Well, your larynx basically sends out two major warning signals. First, there's dysphonia. That's just a fancy word for any change in your voice: hoarseness, weakness, maybe even pain when you talk. The second, and way more alarming, signal is dyspnea. That's difficulty breathing. And this isn't just feeling winded. It's a sign that your actual airway could be getting blocked.
So when a patient comes in with symptoms like these, the big question for the doctor is, okay, how do I actually see what's going on in there? It's not like you can just peek down someone's throat and get a good look.
The answer is a procedure called a laryngoscopy. Now, the old school way involved using a small angled mirror, kind of like what a dentist uses, to get an indirect look. But today, the gold standard is direct laryngoscopy. A tiny, flexible fiber optic camera is passed through the nose and down the throat, giving the doctor a super clear, magnified, real-time view of the vocal cords. Okay, so we're looking inside. What kind of things might we find? Let's start with some of the most common problems. Benign lesions. These are non-cancerous growths that are often caused by how we use or, misuse our voice. This chart really breaks it down nicely. First, you have vocal fold nodules. People call them singer's nodules, but really anyone who uses their voice a ton, like teachers, can get them. They're basically calluses that form on both cords from overuse. And the main treatment? It's voice therapy, not surgery. Polyps, on the other hand, are usually just on one side, more like a fluid-filled blister, and they often do need to be surgically removed. And then there's Ranke's edema. This is a big, diffuse swelling that's almost always linked to smoking. It's what gives smokers that classic deep, gravelly voice. But it turns out, vocal strain and smoking aren't the only things that can cause growths in the larynx. Now we've got to move into some more serious territory, everything from viral infections to actual cancer. So first up is something called laryngeal papillomatosis. This condition is caused by HPV, the human papillomavirus. And what happens is, it causes these benign, wart-like growths to pop up inside the larynx, which can cause serious hoarseness and sometimes even start to block the airway. A doctor can spot these growths pretty easily during a laryngoscopy. The usual treatment is to go in and remove them with a laser. But, and this is the real challenge, they have this nasty habit of coming back. This means some patients need surgery after surgery, sometimes for their whole lives. Managing that recurrence is the name of the game. And this, of course, brings us to the most serious topic. Because while those papillomas are benign, we have to face the fact that not all growths inside the larynx are.
When we talk about laryngeal carcinoma, or cancer of the voice box, we're almost always talking about a specific kind called squamous cell carcinoma. And the two biggest risk factors by a long shot are smoking and heavy alcohol use. In fact, doing both together is way more dangerous than doing either one alone.
Now, this is absolutely critical. Where the tumor is located completely changes the first warning sign. If it's right on the vocal cords, that's called glottic cancer, you get persistent hoarseness very early on. This is actually a blessing in disguise because it gets you to a doctor sooner. But if the cancer is above or below the cords, the early symptoms are much vaguer, things like trouble swallowing or a feeling of a lump. The more serious signs, like trouble breathing, might not show up until the cancer is much more advanced.
Treatment really depends on the stage of the cancer. For early stage stuff, the goal is always to cure the cancer while saving the larynx and the voice. You can do that with things like laser surgery or radiotherapy. But for more advanced cases, sometimes the only option is a total laryngectomy, which means the entire voice box has to be removed. All right, let's talk about one last problem. This one isn't about growths. It's about a failure of the control system. What happens when the vocal cords just stop moving?
This is vocal cord paralysis. It happens when the nerve that tells the vocal cord muscles what to do, the recurrent laryngeal nerve, gets damaged. This can happen accidentally during neck surgery, say for the thyroid gland, or if a tumor is pressing on the nerve, or even from a stroke.
And this slide highlights a difference that is literally life and death. If just one cord is paralyzed, your voice will be weak and breathy, and it's hard to get a strong cough. It's a problem for sure. But if both cords get paralyzed in the closed position, your airway is almost completely sealed shut. This isn't just a problem. It's a full-blown medical emergency that requires an immediate tracheotomy to create a new airway and save the person's life.
You know, it really makes you think. We take the simple act of speaking, or even just breathing, completely for granted. It all feels so automatic, so effortless. But as we've just seen, it all depends on this incredibly delicate and complex system of nerves and muscles. What happens when those controls fail?
From a little bit of hoarseness that's warning you about a nodule to the silent, terrifying blockage of a paralyzed airway, the larynx is just a profound indicator of our overall health. Understanding it isn't just a boring anatomy lesson. It's about learning how to protect our voice, our airway, and really, one of the most fundamental tools we have for connecting with each other.